Have you heard of Seroquel or baby heroin? Well, these are street names for Seroquel. And a 2019 report by the National Institute on Drug Abuse found that Seroquel was one of the top 15 drugs involved in overdose deaths in the United States. Now, there are reports of other antipsychotics being abused, like Zyprexa and Risperdal, but Seroquel is more common, comprising over 60% of all cases of the reported antipsychotic abuse. But why is that? Why is Seroquel being abused? Why does it have street names? Well, in this video, we're going to talk about Seroquel abuse. We're going to talk about what Seroquel is, why it's being abused, the dangers of the abuse, and then finally, why does it matter? Why should we care about Seroquel abuse? So let's get into it. So first, let's talk about what is Seroquel. Well, Seroquel is an atypical antipsychotic or second-generation antipsychotic that I discussed in detail in this video. But just to recap here, Seroquel has very strong action on the serotonin 5-HT2A, antagonizes that receptor site, and is also a moderate dopamine D2 antagonist. It also antagonizes the serotonin 5-HT1A, dopamine D1 receptors, the histamine receptors, and the adrenergic alpha-1,2 receptors. Now, it really has no meaningful action on the cholinergic, the benzodiazepine, or the muscarinic receptor sites. And if you recall in that video, we discussed that a lot of these receptor site actions are dose dependent. But keep in mind that the histamine receptor site action, which gives it most of its hypnotic or anxiolytic effect or properties, is actually found in the minimal dosages of Seroquel. And as you increase the dosages of Seroquel, you start to get the serotonin receptor site activity and dopamine receptor site activity and so on. So then why is Seroquel being abused? Well, as we mentioned, there are many street names for Seroquel. The Seroquel, baby heroin, Quell, and even cue ball when it's combined with heroin or cocaine, and Mac ball when it's combined with marijuana. And a single dose price of Seroquel, or a street price for a 25 milligram pill, is anywhere from $3 to $8 per pill. But why are people buying Seroquel off the street? What's the deal with that? Well, the theory of addiction poses that the addiction response is the reward response system from dopamine being flushed in the mesolimbic reward system or pathways of the brain. And I touched on this and discussed it in the video on antidepressants and whether or not antidepressants are addicting. So if you missed that video, check it out. But the thing about Seroquel is that it doesn't increase dopamine in this pathway at all and actually decreases dopamine overall because it's an antipsychotic. And so therefore, the abuse potential of Seroquel has nothing to do with addiction per se, or nothing to do with a dopamine reward system reaction. What the research suggests is that the abuse potential of Seroquel lies within its hypnotic properties and the anxiolytic effects of Seroquel, and specifically the histamine and adrenergic receptor sites. It has also been stated that Seroquel helps to relieve effects of other substances. So for instance, if you took too much cocaine or amphetamines, you might take Seroquel to help you come down. And it's also been shown to be used as a potentiating effect combined with other downers. It's even been stated in reports to help alleviate withdrawal effects from some of these drugs. So if you can't find your next dose of heroin or opiates, you may turn to Seroquel to alleviate those effects until you get your next dose. There is some evidence about using Seroquel in substance use disorder treatment. However, that evidence is mixed. But though the evidence is mixed, a lot of substance treatment facilities will actually use Seroquel to help with the symptoms of withdrawal from alcohol and even opiates. It's also been shown to help decrease cravings for alcohol and opiates, and of course help with those withdrawal effects, specifically the restlessness and insomnia that comes from withdrawing from alcohol, benzos, and even opiates. Seroquel abuse is also noted in the research to be done by a specific population, and this is the substance use disorder population, so those who are already addicted to other substances or have a history of addiction in their family or are susceptible to addiction will most likely end up abusing Seroquel. Also, it's been shown that people who are involved with the law and end up in jail will abuse Seroquel at one point in time, as initially Seroquel started being abused in the prison systems. And the prevalence of Seroquel abuse has actually been seen to be 15% in those who self-inject street drugs and 17% in those who are already in treatment centers or addiction treatment centers reported abusing antipsychotic drugs such as Seroquel and combining them with other drugs like heroin, marijuana, and even cocaine. And so we understand that it's being abused, it's out there in the streets, and we sort of understand why it's being abused, right? But what about the dangers of this abuse? Should I take my chances on taking some Seroquel from the street? Well, hold the phone. Emergency reports of Seroquel abuse have shown that this type of abuse causes central nervous system clinical effects such as drowsiness, confusion, agitation, and other serious clinical effects such as hypotension or low blood pressure, respiratory depression, meaning you're not breathing like you should, and even seizures. More dangerously, when Seroquel is combined with other substances to potentiate the hypnotic effect, like when it's combined with heroin or marijuana or alcohol, it can actually suppress the respiration rate even more, which will then lead to death. And as we stated earlier, Seroquel is one of the top 15 drugs found in those who overdosed in the United States. So you might be thinking, well, that might be rare. I may not die from Seroquel, or maybe I won't use Seroquel with other drugs. Well, then you're risking side effects. And as we discussed in the video on Seroquel, there are many side effects to Seroquel. Of course, there's the desired side effect if you're using it for sedation or an anxiolytic effect or hypnotic effect, there's that. But there's also side effects such as headaches, dizziness, nausea, dry mouth, constipation, that weight gain, the metabolic syndrome, increase in appetite. Akathisia and agitation can also occur along with extrapyramidal symptoms. And though those extrapyramidal symptoms such as tardive dyskinesia, involuntary movements, and Parkinsonism-like movements or pill rolling movements are considered rare with Seroquel, they can still occur, and that's what you're risking if you abuse Seroquel. You may also be risking neuroleptic malignant syndrome. And if you recall, neuroleptic malignant syndrome, though rare, can lead to autonomic instability and can cause high fever, muscle rigidity, an altered mental status, irregular blood pressures, irregular heart rates, and even lead to death. So definitely pause and think before you try and abuse Seroquel. And now let's talk about, why does Seroquel abuse matter to me as a provider and to you as a patient? Well, there are several reasons why it matters. Number one, it has been debated that Seroquel should actually be categorized as a controlled substance, making it a little more difficult for patients to obtain. Now, what that means for someone who doesn't abuse Seroquel is that if you feel that Seroquel really works for your symptoms, say you're bipolar, and you know Seroquel really works for you, and you stop taking it, but now you want to get back on it, if it's now listed as a controlled substance, the prescriber may think twice about prescribing it to you. So it puts a little bit of weight on the prescription of Seroquel and perhaps even some stigma related to taking Seroquel. The other thing is that prescribers will then be more cautious, which they should be more cautious about prescribing Seroquel now that they understand this abuse potential, right? But that also leads to stigma and perhaps stereotyping. So prescribers have to be careful there and making sure that if you are a prescriber that you're getting thorough, detailed history and doing a thorough assessment of your patients, making sure that if there is substance abuse history, that if you're going to prescribe Seroquel, you also make sure to inform the patient of the risks of abuse. And when I look at this whole picture of Seroquel abuse, I look at it more as a cry for help, and that's why it matters a lot to me. Because when patients are going out to the street to look for Seroquel because they're struggling to get their drugs or they're struggling with withdrawal effects, that's a cry for help. And so if your patient comes to you and is asking for Seroquel and perhaps they do have a history of substance abuse, ask them why they are seeking Seroquel. Perhaps it's more for relief. And in that case, you can help educate them on how to safely taper off of their drugs and perhaps even use Seroquel safely in a controlled environment like a treatment facility. Now, I also say that it's a cry for help for these treatment facilities because I used to work in a detox treatment facility, and I can tell you that we detox patients very quickly from all substances. It didn't matter if it was alcohol, opiates, or benzos. A week or two max was the norm and is the norm for many treatment facilities. However, perhaps we should take a step back and look at that treatment model. Perhaps we're detoxing patients too quickly, especially when it comes to benzodiazepines. There's a slew of research and even a whole manual called the Ashton Manual that talks about the dangers of coming off of benzodiazepines too quickly and why you need to taper over months or even years. And so that begs to question, why are we taking patients off of medications too quickly? Perhaps that's a topic to discuss with other providers at another point in time, but it's definitely something for all of us to think about. And when it comes to coming off of medications like benzodiazepines, antidepressants, or even coming off of drugs, take a whole holistic approach with your patient and think twice about tapering them off too quickly, as they may turn to other drugs and other substances to relieve their symptoms, such as using Seroquel and end up abusing Seroquel and perhaps end up in the emergency room and ultimately end up 6 feet under. So that wraps up my video on Seroquel abuse. Do you have any experience with Seroquel or Seroquel abuse, or have you heard any stories about it? Please let me know down in the comment section below. Remember that we learn from sharing each other's stories and experiences, and I really enjoy reading the stories, and a lot of you support each other within the comments, and I really appreciate that. And as always, I thank you for watching. I wish you well on your mental health care journey, and I'll look forward to seeing you all next week.